guys, I promised you I would do a little video to help you supplement your study, and this is that video. If you are using this video to replace using the study guide, I'm asking you to not do that. Please only view this video after you've completed the study guide. I want you to start to think of what are the underlying causes of some of the symptoms you see in diabetes. So when you have low blood sugar, your body goes into a fight or flight response. And so if you could think back to some of the signs of and symptoms you remember from earlier classes in fight or flight response. For example, you know that the heart rate goes up, urine output may increase, other kind of things like that. So how does your body respond? You also will see changes in the way that your body metabolizes. So if the body can't get glucose into the cell, then it stays out in the serum. If the glucose is in the serum and not in the cell starves. So what does that look like? What does the cell have to do in order to get energy when it's starving? And how does your body adjust to that by getting calorie sources from other sources in your body, for example, your liver and your fat stores. And then I want you to think about what would cause Kusamal breathing that you sometimes see with ketoacidosis. What causes for example, the acetone breath, the fruity smell that you get with high or low blood sugar. And then think about how glucagon is used in the body. So make sure that you look up and you're able to explain what glucagon does in your body. So when we get to having high glucose in the blood, excess blood is a particle in your serum. And so particles in the serum is also called osmolarity. So when you have a fluid and you have this higher levels of particles at a higher osmolarity, how does that osmolarity affect the flow of fluid in and out of the cell? So as we know, you need a very specific balance of sodium in the blood, and that affects how much fluid goes in and out of the cells. So having said that, if glucose does the same thing, that's why high glucose leads to a diuresis of fluids out of the cells and then out of the body through the kidneys. So also glucose in the blood can affect the vision, for example, and obviously in long-term uncontrolled diabetes you can have blindness, but prior to that, just when your blood sugar is excessively high, even for a little while, for a few hours, you can start to have blurred vision and see that. Also, high glucose in the serum damages the body's white blood cells and the immunity. So how does that affect the, for example, wound healing? So be able to answer questions like that. Also, when the brain is starved of blood, how does that look? And I've pointed that out to a few of you, that can tend to look like irritability, anger, and in extreme cases, seizures result then when you have extreme low glucose. So be on the lookout for that. Those are neurogenic symptoms. High blood sugar, like I said, impairs the immune system, and all of these are true both in type 1 and type 2 diabetes. So if you have a child out in the community that has high or low blood sugar, you need to know how you would treat it for this. And so if the child's awake, what do you do? Can you give them a sugary snack? How much of a sugary snack should they have? And then once they're in the hospital, what do we do? So we obviously have access to IV fluids, such as D50 if needed, D5, D10, we have different fluids. Also think about if the osmolarity of the blood is changed, um, how can we adjust that with different hypotonic or hypertonic solutions. And then also, as you know, when you diurese a lot of fluid, you lose a lot of potassium. Potassium is low. So do we have IV fluids that help replace that potassium? Also, when kids are out in the community, we want to know, okay, so the parent's given them sugar and they're not unconscious, so could they give them next? So what else are snacks that are healthier that you can give? So obviously we don't want to just feed them cake frosting until they're full. So what would we give them after that? Also consider what they do on sick days, days when they're sick and they have to keep taking their insulin, but they can't keep any food down. Or what do they do on a sporting day when they have, say, basketball practice or soccer practice? They're going to burn a lot of calories, they're going to be low on sugar, and we want to keep them from going into uh, a low blood sugar episode. So think about those things, the best kind of snacks that they should be able to have, and be able to connect all the symptoms that the child has to the underlying cause in the body. Other problems that we're going to talk about with endocrine are SIADH, which is a syndrome of inappropriate antidiuretic hormone. So as you know, ADH is also called vasopressin, and it's made in the hypothalamus. And it has to do a lot with how the body balances the fluid and salt of the body. And so remind yourself of the RAS system, of course. And that's how we regulate blood pressure and the fluid that comes in and out of our bodies. So if you have an issue with regulating fluid, does that mean that you have too much fluid or too little with SIADH? How does that look? And how would you treat that? Would you give the patient more fluid or less? Would you restrict their fluid? Also think about how that affects sodium. Is the sodium high or low with this patient? And does that mean should they have more salt or less salt? And then what are some of the symptoms of SIADH? For diabetes insipidus, I want you to be aware, and I've said this before, I'll say it again, diabetes insipidus has nothing whatsoever to do with the pancreas. And so it is caused by a hormone deficiency. Make sure that you can look that up and name the hormone deficiency that's involved. And then what signs and symptoms do you expect based on your knowledge of that hormone? How do we treat it, and what happens if it's not treated? So worst case scenario, what happens? Um, so also you would want to know then important parental teachings and nursing interventions, and signs and symptoms then based on what you know. What are the three P's? Polyuria, polyphagia, polydipsia. Which one of those doesn't apply to diabetes insipidus? One of them does not apply. All right. I also want you to be able to pick off of a list of different disorders which ones cause short stature, and they don't have to be just endocrine disorder, but some of the other disease processes we've covered in prior chapters can cause short stature. So make sure that you are able to pick those off of a list. Also, so what other organs are involved in growth, and what kind of medications affect growth? So you could probably, if you Googled that, you'd probably come up with a list of like 100 of them. But there's one that we've talked about extensively in the class, and you should be able to name that one. Let's see. Think about how hyperthyroidism or hypothyroidism can affect growth. Other topics that we'll be going over on this test is precocious puberty. How is it recognized? How do we define it? What are the treatment protocols and the surveillance protocols for that? And what are important nursing teachings for the child and the family? Also, the PKU test is also called metabolic testing or metabolic screening. That's done in all 50 states. And remind yourself of the important points about that. Remind yourself, like the conversation we had about what you would say to a parent about why we do it. And remember with questions where we're talking to a parent that it has to be a therapeutic response. So it should be something that doesn't cause them a lot of fear or anxiety, but also gets the point across that's truthful. Cortisone, as we know, has some important effects, and so you should be able to name those effects, safety indications, and things for children, and familiarize yourself with that before the test. For neuro is also on the test. What are the different classifications of seizures? There's several types, and you should be able to recognize them by a short description. What are nursing interventions that you would expect to do if you had a patient that was seizing? What would you do after the seizure? What kind of interventions would you hold till after the seizure and do them at the end? What are you going to do if you need help in the room? And what would cause you to try to get help in the room? Certain interventions are very inappropriate during a seizure, and you should be able to name those. For example, you can't leave a child alone during a seizure, so what would you do in that case? Meningitis is also going to be on the test, and so you should be very familiar with how we recognize meningitis, signs and symptoms, how is it treated, what kind of nursing interventions are done, and how do you prioritize your care. What are signs of hydrocephalus, and what causes hydrocephalus? What are signs and symptoms of increased intracranial pressure? And how do we test for meningitis and hydrocephalus? How do we recognize that? If we're doing a lumbar puncture, what's the nurse's job during the lumbar puncture? What is the right positioning for a lumbar puncture? What kind of fluids do you expect to see? And how should the fluid look based on different diagnoses? For hydrocephalus, we often treat that by placing a shunt. So what is the purpose of the shunt? How do you troubleshoot the shunt? If it's not working, what are complications of shunt malfunctions? Also, as far as intracranial pressure, I want you to think of head injuries, which also cause intracranial pressure. So what kinds of head injuries are we concerned about? So if there's bleeding in the head, if there's a concussion, or what about if there's a skull fracture? So consider those. And also we talked about at the end of the neuro lecture about basilar skull fractures. So make sure you can talk about what you look for and what your concerns are with a basilar skull fracture. Also, when patients have increased intracranial pressure, what are the interventions that we do environmentally? Because remember, the nurse is also responsible for the environment of care. So, and I'll give you an example, we often dim the lights. So be able to come up with a couple of others and be able to talk about how you would change the environment for that patient. We also have space-occupying lesions which can cause intracranial pressure. And so by that, we usually mean cancer, but sometimes you can have benign things too. But cancer takes up space, so as it grows, it causes more and more intracranial pressure. So what are the early signs and late signs of that? We also covered cerebral palsy in the neuro chapter. So how does that present? What does it look like? There's a couple different types of cerebral palsy, so be able to differentiate the presentations. GU is also going to be on the test. And so what are the categories that we went over in class about the causes of GU disorders? So, kids can be born with a congenital abnormality from birth, or they can have an acquired problem later. As far as the congenital abnormalities go, there's obstructive defects, there's defects where the organs are born on the outside. So make sure that you review all those categories of defects. Specifically, also, you should know how certain syndromes present. So, for example, nephrotic syndrome, how does that present? What are the important teachings regarding nephrotic syndrome, and what are the nursing interventions? Be able to talk about group B beta hemolytic strep disorder, and talk about how that is recognized, how it's treated, and what are the risks and complications of having that. What kind of complications to the GU cause the child to have kidney failure where they need dialysis, and what are complications of dialysis? So I'll give you an example. Infection is one, but there's a couple of other ones, and you should be able to name them or pick them off of a list. Also, there are certain nephrotoxic antibiotics that we give to patients that have certain infections in the GU. So if it's nephrotoxic, which ones should we avoid? So if you had an order for that from the doctor, what would make you question it? So make sure that you, and I don't need you to just Google how many antibiotics are nephrotoxic, but think of the big drug class first. So which drug class of antibiotics is the most nephrotoxic, and then just pick off the ones that you would be concerned about on that, out of those smaller number, which of those you would question, and think of ones that are common, not uncommon. Also, let's see, UTIs. So how do kids get UTIs? What puts them at more risk for UTIs? How are UTIs recognized? So we do a urine sample, of course, and it should probably be a sterile catch as opposed to a clean catch. How do we do those in kids? And what kind of urine do you expect when we're doing different tests for your kidney problems? What color should you see? So for example, you would see cloudy urine if there's a UTI, but other presentations of urine indicate other things. So take a look at that, remind yourself of that. There's a few vocabulary words that you need to know in this chapter, and so basically the word is on the left side of the question and you have to match it on the right side of the question. So make sure that you have a pretty good idea of the vocabulary, or maybe some of the disorders that we didn't talk about much, but you can at least match it to what it is. Talk about the mechanism of injury in kids that have kidney injury from, say, a trauma. So, for example, think about being thrown from an ATV. So think about that kind of injury and how does that present. So how do we know that the kidney's injured? How does that look? Is there any kind of presentations that you can talk about? So of course we're going to do a CT, but is there anything else? Discuss complications of hypospadias and hyperspadias and what kinds of interventions we do for that, and how that happened. That's it for now. I hope that this is helpful to you, and that you can view it more than once, and that it'll help you study. Thanks.